rights of medication administration. Medication administration is one of the most crucial function of a nurse because life and death is on your hand. The medication you're holding is life and death at the same time. So every day today as a nurse, we make use of these 10 rights to give medication. I have decided to devise a form to help me remember these 10 rights, and that is targeting it or listing it in a chronological manner. So number 1 is the right patient. So identifying your patient is not only by name. What is your name? If the patient, because of name alert, name that sound the same, name that are exactly the same thing. So if the patient is alert and oriented ×3, you can go further to ask what is your date of birth. But if you're working in a place where patients are very confused, especially in the long-term care setting, sometimes they have a wristband as a form of identification. Some nursing homes don't permit the wristband. Sometimes they have a picture on the email. The computer you're carrying to do the med pass have the patient picture when you pull up the patient's name. And if you're very confused, is it not better that you ask several people than making a med error? That is identification. Comes another one. After you identify the patient, if you're doing a med pass or doing a procedure on your patient, the next thing is for you to obtain consent. So obtain consent is Mrs. Sandra, I want to give you this medication. So giving us the second right to refuse. So patients have the right to refuse their medication. If they refuse, you are not going to rejoice because added work, he or she have created an added work for you. If the patient refuse insulin, for instance, ma'am, I want to give you this insulin because your blood sugar is 500. The insulin will help to lower it down. I'm doing a patient teaching. So you teach the patient the benefits, the risk, the complication of refusing the medication, and you inform the doctor and follow whatever is the protocol. So after the right to refuse, we are getting another right, which is now the right medication. The patient accepts the medication to take the medication, so you go to find the right medication. Insulin have insulin long acting and insulin short acting. Insulin long acting, if you mistake insulin long acting in place of short acting, you might be sending somebody to become an angel faster than expected. So you are going to be very serious when selecting every medication, most especially medication that adds so fat like insulin. So when you get the right medication, now comes what next? The next right for me is the right time. Because if you go check the dose and start processing the medication and it's not the right time, it's not going to be a nice idea. So another right is the right time. The right time for medication, universally accepted, is 1 hour before and 1 hour after. Many patients, especially patients on pain medication, narcotic, a minute after the scheduled time, they're already very mad with you. So right time, if a medication is scheduled to be given by 9 a.m., anything from 8 o'clock up until 9:59 is correct, the universally accepted right time. Also, when we are talking about right time, we will not forget to remember that some medication generally they are given at night time. Some medication generally they are given early morning in the empty stomach. Some medication they must be given after meal. There are reasons why those medications are programmed to be so. So they are part of right time. So now it is time for medication. We are going to check the right medication. So now that it is right time, we have talked about the right medication. At the right time, we talk about the right dose. So right dose, sometimes, especially if it is infusion, you might need to do 1 or 2 calculations to arrive at the correct dose. If you are in doubt, ask your senior nurse, ask the pharmacy. If they will mock at you, they will mock you. They can only mock you 1, 2, or 3 times, and the rest one, you'll be the one teaching others. So then the right dosage. When you arrive at the right dosage, then the right site. Is it a PO medication? Is it injection? Which type of injection? IM injection, IV injection, subcutaneous injection? After the right route comes the right assessment. Right assessment is that if you're giving somebody fast-acting insulin, you must check the blood sugar. You're giving somebody blood pressure medication, you need to check the blood pressure. And some medication, you need to check the lab value. In some type of blood thinner, you need to check the PT and PT/INR. So after the right assessment, then comes the right documentation. If you do something in health and you forget to write or document, it's assumed you didn't do it. So write documentation. You're going to start with why you're giving the medication, PRN Tylenol given for pain, giving PO, giving injection, the milligram, the time of administration, the dosage. Documentation is an ongoing thing. But if you give a medication, you don't need to wait until the end of the shift before you document. Because before the end of the shift, something critical might happen to the patient. So you document medication administered. You can come up to update your documentation as the effectiveness of the medication. So after the right documentation, we are going to get the right evaluation. Did the patient vomit the medication after you gave a pain medication? Did the pain remain the same? Did it get worse? Was it relief? Everything about effect of medication of the body. Did the patient witness therapeutic side effects, allergic effects, idiosyncratic effects? I've done pharmacokinetic on this platform. So after the right evaluation comes the what other rights? So let me list it and see if I'm going to get the 10 of them. Right patient, right medication, right patient, right to refuse, right medication, right time, right dose, right site or route, right or site of administration, right assessment, documentation, and then right evaluation. 1, 2, 3, 4, 5, 6, 7, 8, 9. So I was able to get 9. I don't carry book to teach, so I'm giving you my student assignment to find the 10th right of medication administration. Thank you for listening. See you in my next video.